I am here to tell my story about my journey through perimenopause. I am Dr. Kerri Nevin. I am a doctor of clinical psychology, and I've been in private practice with my husband, Paul, for the last almost 30 years. And about 5 years ago, I woke up with a frozen shoulder. And, I didn't know what was happening to me. When I look back, of course, hindsight is 2020, but I realized that my body had been talking to me for some time. In 2012, I had a partial hysterectomy, so it wasn't cycling, and I didn't know where I was in terms of perimenopause. In fact, nobody had ever even spoken the word to me. I didn't know what that was. But I do remember really, really suffering. I was having joint pain so badly, it was hard to simply walk. And I'm somebody who likes to, be active. I dance and, do P-Volve. I have a lot of classes that I attend. And it's one way that I feel really alive. I should mention, was diagnosed with Hashimoto's thyroiditis, which is an inflammation of the thyroid gland. That was in 2011. So unbeknownst to me, I was struggling with Hashimoto's at the same time I was in perimenopause. And it was now what I realize is that the perimenopause symptoms were really putting jet engines on everything that I was experiencing, both mind and mental and body, physical. And I just remember looking in the mirror this one day after I tried getting in touch with my physician for the 4th time, and I wasn't getting a call back. And I was so depressed. And I just looked in the mirror and I saw the cystic acne that I was dealing with. I saw the weight gain that would not budge no matter what I did. And my mood was I just wasn't myself. And I remember just breaking down, wondering what it was gonna take in order for me to feel like I had some measure of control over my body, over who I'd known myself to be. And then I started getting information. I started to research nutrition and the impact that can have on your health and your well-being. And I just made it my business to really be conscious of what I was putting in my body. And I will say that I ended up reversing my condition of Hashimoto's, and I started feeling great again. I started remembering who I was. But as I said, about 5 years ago, I started really having these hot flushes. I didn't know what they were. I didn't know what was going on. I just thought, why am I so hot? What is happening to me? And again, the joint pain came at me, just overwhelming me. And then one day, a colleague of mine said, have you ever heard of the musculoskeletal syndrome of menopause? And I was like, no, what's that? And I started down the rabbit hole. I started researching. I looked up Dr. Vonda Wright, who's an orthopedic surgeon and a menopause specialist. And as it turns out, what I learned is that estrogen, which is one of the main hormones in our bodies as women, men also have this, but once that estrogen starts to diminish, it can result in joint pain, because estrogen is like oil for the joints. It keeps everything lubricated. But not just that, it also impacts our neurotransmitters, our serotonin, our dopamine. That impacts how we perceive ourselves and how we perceive others in the world. So perimenopause, even though I didn't know what it was, I learned. And it was a wake-up call for me. And now it's what I want to do. I want to make sure that all women have the information ahead of time so that you can be making the decisions and making those joint decisions with your doctor that are best for you, to understand the science behind the loss of hormones and what that means for you, both on a mental and a physical level. And so I paired both of my passions, psychology and now menopause. And I now am known as the MenoPsychologist. And I am here to educate and to guide women through the noise of all of the information that's out there that can feel so overwhelming sometimes, and to have you have the right information. And so toward that end, I created the Peri Power Hour, and that is a gathering at my office. It's virtual, so anybody can join from anywhere, where I teach a lesson, and then that's the first half of the hour, and the second half half of the hour is us having a group discussion. In that, we will discuss science-backed information that will alert you to your options, to your choices, and that's when we really feel the best. So if you feel inclined, please join me. I am Dr. Kerri Nevin, the MenoPsychologist. You can find me on Instagram at the MenoPsychologist, or you can go to my website, www.menopsychologist.com, and let's get educated, let's get informed, let's get empowered, because your life is waiting.